Well, on the ground, I think what we're seeing right now, and there are really a lot of efforts to ensure that literally everybody who walks into a health facility has the opportunity to get themselves tested for HIV, because it's the point of entry. If you do know your status, you can make decisions about either ensuring you stay negative, or if you are positive, then you can make a choice about living positively and accessing treatment at the time you need it. With regards to tuberculosis, it's very important that anybody who gets diagnosed with TB also gets tested for HIV, because up to half of those who have HIV will end up also being diagnosed with TB. And similarly, those who are being treated for TB, probably up to half, have HIV, whether they are aware of it or not. So it's really important that people do get tested either which way. And there are massive efforts to try and make sure that that happens, and that those who get tested with TB, that they do know that this is a treatable condition. And so long as they can adhere to the treatment that has been prescribed for them over the duration of time that they need to take it, that they can be totally healthy and declared, TB-free. Kenya, I believe, right now is at the forefront of offering voluntary male medical circumcision, something that I think government and policymakers and the implementing arms of the ministries of medical services and public health can be very proud of, that we have been able to offer this to a huge number of men. And I believe we are leading in terms of the numbers who have been circumcised thus far. It provides a unique opportunity for talking about reproductive health to men who are in their reproductive ages, and not only offering the service of circumcision, but providing that as an opportunity to talk about HIV prevention and providing them with an opportunity to get tested so they know their status. So that's something that I think we are doing well. We probably still need to do more about learning how to ensure that men who are circumcised do not resume sexual activity early. That could also put them at risk. And also that they do understand the message that this reduces their risk but does not eliminate it, so that they do not thereafter be engaged in high-risk activities that could then put them at risk of still getting HIV, because we know that it reduces risk, but it doesn't mean that somebody is totally immune and cannot get HIV just because they're circumcised. We haven't had as many of the challenges in that regard as our neighboring country, I believe Uganda, has had, from what we see in the news. But it is something that we are taking very seriously and watching out for. I think there's a lot that's being done to ensure that we do not experience stockouts. And the challenges still remain from the implementing side in terms of just ensuring we have enough drugs. But so far, I cannot say that I've seen anything to indicate that we have had a challenge with stockouts. But there is a potential danger if we do not take care. What we did have a stockout of was condoms a short while ago. And one of the things that I think was an important lesson was, yes, we had some challenges in procurement and all the different coordinating agencies ensuring that we had them on time. There's a very rapid response that ensured we did get the condoms in very short notice. But I think for me, the lesson was, it's great that people actually recognize that a condom shortage is a major issue. It's a national sort of disaster. And it also shows that there's enough education that has gone out, that people are so aware that there's a hue and cry the moment people can't get access to condoms. It shows that people may be taking decisions about their sexuality and what they want to do and ensuring that they are protecting themselves. So all in all, to me, it was a good thing that it made us aware that people are making choices about what they want to do with their lives.